Thank you so much. Joining me now, Dr. Cedrek McFadden, board-certified surgeon and African-American health advocate, and Dr. Holly Phillips, internist in private practice here in New York. Big good morning and welcome to you both. Dr. McFadden, I'll start with you, sir. As the states are gradually reopening and all this warm weather is bringing more people outside, there is some new research suggesting that summer's heat, the humidity, as well as the sunshine could really help inhibit, not halt, but inhibit, slow down the spread of coronavirus. And you have the Washington Post reporting that there is a new working paper and database put together by researchers at Harvard Medical School, MIT, and other institutions examining, in fact, a host of weather conditions worldwide to try to determine the relative COVID-19 risk due to weather. So ultimately, doctor, they found the average temperatures above 77 degrees are associated with a reduction in the virus's transmission. So your thoughts on that? Does that make sense to you?
It makes sense. You know, if you think about what's happening in Ecuador and Brazil, where these temperatures are low, you're still seeing some viruses being diagnosed and still seeing that being present. But it does make sense that if we look at what's happening with other viral type infections, whether that be influenza, SARS, or even the Middle Eastern respiratory syndrome, we've seen that same sort of decrease when the season warmed. It's not knowing what's happening in the fall when the temperatures may decrease again, but certainly that's the pattern that we would like to see.
Okay. Heat notwithstanding, Dr. Phillips, does that even make a difference if people aren't social distancing or taking other precautionary measures?
Right. I mean, I think we're all sort of trying to look for some good news in all of this, and it does seem that heat and particularly humidity may be good at helping us fight off the virus. It lowers what's called the Rose score, making the virus less contagious from person to person. However, climate is really just one part of the equation when we're looking at this viral spread, and it's not really the most important part. The most important part is our behavior, whether we're in close contact with one another, and whether we're doing the basics of keeping the virus at bay through testing, contact tracing, and quarantining people that require it.
Okay, let's take a look at a new piece in the Washington Post. It's titled, "We Could Stop the Pandemic by July 4th If the Government Took These Steps. Frequent testing, tracing, positive tests until no new positive cases are found." And it also encourages voluntary isolation to prevent further disease spread. Isolated patients would receive some sort of federal stipend to discourage them, in fact, from returning to workplaces too soon. Dr. Phillips, to you on this, is that idea realistic?
You know, I think that the idea can be realistic, and I think that in other countries where we've seen really effective viral control, right? Germany, Singapore, Taiwan, South Korea, these are strategies that are in place and have been shown to work. And this was the original strategy that public health advocates had spoken about from the very beginning of this virus, right? When we first started to see community spread at the beginning of March, the idea was to find everyone with the virus, test them, closely trace their contacts, and isolate only the people that needed to be isolated. That wasn't done effectively, so now essentially we're all quarantined.
Yeah.
I do think that there is a basis to all of our to be able to understand that this strategy can work. Whether or not we can get it up and running is the question.
But Dr. McFadden, July 4th, I mean, is that realistic? And does the country even have the capacity to do the kind of testing and tracing that is needed? I mean, again, July 4th, we're talking, what, 6-7 weeks?
And you think about the folks that have to get these tests. My concern is the test, or are the tests going to be taken to the most vulnerable populations? Are they going to have access to the testing centers or even the care that they may need after those tests are performed? So that's a really important question that has to be answered in that time frame as well. And it's not just the test that has to be done. You have to have the swabs, you have to have the extraction media, you have to have the vials, you have to have the personnel to perform those tests. So it's a full team effort on a lot of different fronts that have to be met in that short time frame.
And Dr. McFadden, staying with you, sir, this article also talks about dividing the country into red, yellow, green zones, all based on the percentage of people in each state who are infected. Those zones would determine the amount of tests that each state should have to be doing what preventative measures they should be taking. What are your thoughts on that? Is this effective? Is this realistic?
So I think it's certainly a nice framework to actually start from. Right now, most of us, as they characterize, are in the yellow zone, where we have anywhere from 0.002% to 1% cases. That's places like D.C., Virginia, and even Maryland. And so we're seeing those red zones, which is like New York, Louisiana, Michigan, where those numbers are greater than 1%. That's concerning because it's going to take some time, and we have to have the investment of nearly 5 million tests per day to get us all to this green zone we'd like to be. And right now, we're only doing 300,000 tests per day. So we have a long ways to go to get to that point.
Okay, perspective offered there from you both. Dr. Cedrek McFadden, Dr. Holly Phillips. Thank you both, doctors. Good to see you.